Did you know that 90% of people who have chronic kidney disease don't even know it? Early kidney disease usually has no symptoms, but as the disease progresses, it can lead to kidney failure, which may require, in the final stage, a dialysis or a kidney transplant and increase your risk for heart disease. In this video, we will talk about symptoms and complications of chronic kidney disease and how we can avoid it and take charge of our kidney health. Stay with us. Hello and welcome back to our channel. Before we get into the video, please make sure you hit the subscribe button so you can be updated in upcoming informative healthy videos. Also, please feel free to comment in the box below to share with us and others your tips and thoughts. Chronic kidney disease, or CKD, is a serious condition. It is the 9th leading cause of death in the USA. 1 in 7 adults have chronic kidney disease, and every 24 hours, about 340 people begin dialysis treatment for kidney failure. In the end of this video, we will talk about the kidney disease solution, which is a proven natural program and a fully digital program for reversing kidney disease and living a normal, healthy life that you fully enjoy. First of all, let's understand what is CKD and what are the symptoms and the complications of it. Many conditions within and outside the kidneys can cause progressive damage to the kidneys over time, leading to chronic kidney disease, which is actually a gradual loss of renal function. Chronic kidney disease, or CKD, develops slowly. Therefore, you should listen to your body and understand the symptoms of CKD to know if you are at risk. In this way, you will stay healthy and will enjoy the chance you get every day to live the best life. Managing your kidney disease may seem difficult, but each step you take can make a difference. Before we get into the symptoms, you should know 3 risks that if any of them apply to you, you should see a doctor for a CKD test. By the way, testing for CKD is as simple as a blood and urine test. 1. If you have high blood pressure, diabetes, or heart disease. 2. If anyone in your family ever had kidney problems. 3. If you often use over-the-counter pain medicine or any recreational drugs. Even if you don't have these risk factors, there are several symptoms which you should watch out for. Consider that everyone experiences symptoms differently. So, if you have any reason or concern, talk with your doctor. The first symptom is swelling. Are you swelling in your hands and feet? Maybe puffiness around your eyes in the mornings. If your body holds on to fluids in these ways, maybe it's the kidneys aren't working right. Do you have shortness of breath, even when something requires very little effort? Maybe the fluid is unfiltered and builds up in your lungs, causing shortness of breath. Have you lost weight because you do not feel like eating? Feeling lost in appetite? It may also come with nausea or vomiting. It could be because of too much waste in the blood that can also change the level of hunger. And this is due to impaired kidney function. Kidney problems cause the accumulation of toxins that can cause severe itching and other things. Did you feel a change in bathroom habits, like getting up more at night? Have you noticed a significant change in the amount of urine? Whether it is frothy or bubbling, paler or darker, or if there is blood in it. Are you feeling tired lately? Maybe with trouble concentrating or feeling cold? You feel that your mental ability has decreased. Feeling low energy may be a sign related to issues with the kidney. Pain in the lower back that does not change with stretching or moving or even gets worse may be a sign for CKD too. As we have said that everyone experiences these symptoms differently, so they can vary from one to another. But knowing your risks and what to expect is definitely a great start to avoid CKD. It's important to say that each of these symptoms can have different causes and not necessarily CKD. But if you update your doctor on any symptoms or risk factors, it only helps you avoid health complications. Especially when it comes to the kidneys, getting proper help early can make a big difference in kidney disease management. Let's talk about the complications and how it works. The most common destroying renal tissue are hypertension and diabetes because they directly damage blood vessels within the kidney. This kidney injury, if not resolved in time, may become chronic kidney disease. Glomerular filtration rate, GFR, is an indicator of how well the blood is filtered by the kidneys. Based on GFR, the severity of renal disease is evaluated. It takes into account the patient's age, gender, and race. Renal insufficiency can develop to end-stage renal failure because symptoms develop slowly over time. Renal adaptation is a situation when the remaining healthy tissue becomes more active and can temporarily compensate for the initial loss of renal tissue. Therefore, often there may be no symptoms at first when a significant portion of kidney function is already lost. Symptoms, which mentioned past in this video, begin to appear. The main job of the kidney actually is to remove metabolic waste, produce several hormones, control fluid/electrolyte balance, and blood pH. Therefore, a loss of kidney function may result in complications like anemia, caused due to reduced renal secretion of erythropoietin, a stimulating factor for red blood cell formation, metabolic acidosis, or increased blood acidity, cause of reduced excretion and hydrogen ions. Hyperphosphatemia is caused due to reduced secretion of phosphate. Range of symptoms like nausea, vomiting, seizures, and confusion can be caused by the accumulation of toxic nitrogenous wastes. Hypocalcemia, low calcium levels in the blood, are due to reduced kidney production of calcitriol, an active form of vitamin D. A condition of low blood calcium in the blood causes the thyroid gland to produce more of the parathyroid hormone, PTH, in an attempt to raise calcium in the blood. PTH promotes calcium release from bones. This sequence eventually leads to secondary hyperparathyroidism or hyperthyroidism, which may develop before hypocalcemia occurs. The bones become thin and weakened because they continuously lose calcium to the blood, and then a condition known as renal osteodystrophy develops. Symptoms include joint and bone pain and an increased risk of fractures. Potassium overload in the blood, or hyperkalemia, is caused due to reduced excretion of potassium. This may cause cardiac arrhythmias. Only in advanced stage hyperkalemia usually occurs, but you may precipitate the condition in earlier stages by excessive potassium intake or use of medicine that prevent potassium excretion. By tests that include blood and urine samples, kidney function is diagnosed. Ultrasound is performed to detect kidney blockage. Based on kidney size, it may also help in distinguishing between acute kidney damage and chronic kidney disease. Unfortunately, in the final stage, a kidney disease requires dialysis or a kidney transplant. But treatments are designed to control the underlying condition and involve supplements, treat certain complications and restrictions. So, how can you take charge of your kidney health and avoid kidney disease? You can take these steps. Quit smoking. It can make kidney damage worse. Manage your blood pressure and stress. Get 7 to 8 hours of sleep each night. In your daily routine, make part of physical activity for 30 minutes at least. Even a small amount can make a difference to your health. You should try meditation activity. A qualified mental health care provider can be a great idea too. Be sure to take medicines as prescribed and avoid medicines like naproxen and ibuprofen. Work with a registered dietitian to make a healthy meal plan. Even if you don't have any symptoms, meet with your healthcare team for help managing your kidney disease. Any concerns, challenges, or questions, discuss with your doctor. That leads us to talk about the great solution which has helped so many people with kidney disease. It's the Kidney Disease Solution. The Kidney Disease Solution is a proven natural program and a fully digital program for reversing kidney disease and living a normal, healthy life that you fully enjoy. It creates the entire foundational treatment plan, including diet, exercise, lifestyle, and mind-body techniques that are proven to reduce kidney disease or to stop anyone from getting diagnosed. For more deep information and improved review results about the Kidney Disease Solution, click the link in the description below. That's it for now. Please don't hesitate to take charge of your kidney health today. If you find our video helpful, like and share. And don't forget to subscribe to our channel to see other helpful, healthy videos and tips. Thank you everyone and have a healthy, happy life.